It's 11:30 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're moments away from bringing you a briefing from the South Korean health authorities on the coronavirus situation here in South Korea. Very soon, we'll cut into the briefing room at Sejong Government Complex with simultaneous interpretation available for you in English. A Health Ministry official, Yoon Tae-oh, is expected to be providing us with all the details on the COVID-19 situation in the nation, filling us in on the number of new infection cases seen as of midnight on Friday. Also, he's expected to tell us what kind of efforts the government is making to contain the coronavirus here in Korea, especially with the very recent increase in the number of cluster infection cases in the metropolitan area that are happening at mostly workplaces and small gatherings outside. So we've seen the number grow and grow every single day, but the government, of course, is doing all it can to really contain those numbers, and it looks like he's just made it to the podium. So let's take a listen to what he has to say.
Let us now begin our regular briefing for December 4th, Friday. As of today, midnight, we have a total of 600 new local infections. Among them in the metropolitan area, we have 463 new cases, and in the non-metropolitan area, we have 137 cases. And we had 7 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. We have seen 600 new daily cases, and this is the third time we have this all-time high number of daily cases surpassing 600. And especially in the metropolitan area of Seoul and Incheon and Gyeonggi-do province, we have about 77% of our domestic cases, standing at 463. This is the largest cluster infections in the metropolitan area since our pandemic outbreak. And centering around the metropolitan area, we are also seeing an uptick in the number of new cases as well as a spread of the virus. And for we are expecting the effects of the social distancing in the metropolitan area to reveal and to be unfolded. However, we are seeing a rapid increase of the cases, and this means that the current situation is at a very critical juncture. And as for the metropolitan area, in our daily routines, we need to note that we can be exposed to the virus at any time, at any place. And in the metropolitan area, we ask all of the residents to recognize the graveness of the situation, and please refrain from going outside if it's non-essential, and please minimize physical contact with others. Please cancel all of gatherings or events, and please do not go to multi-use facilities that are crowded and confined. And the level 2 social distancing in the metropolitan area will also be lifted on the 7th of December, and we will be deciding, and we are currently negotiating on the necessary measures going forward. And until the weekend, we will be listening to many experts' opinions, and the final decision will be made after the weekend. And through social distancing measures, we are able to contain the virus, and in order to do so, the government's restrictions on gatherings as well as business operations are very important. However, on top of this, we also need the public's voluntary efforts and participation. We ask the members of the public to recognize the need of such quarantine measures, and if you do not take measures, the government needs to take compulsory measures. So we ask the members of the public to recognize that the situation is a very big crisis for the country, and please partake in our quarantine measures going forward. In particular, due to social distancing measures, many self-employed as well as many small business owners are faced with difficulties and challenges. I also feel for them as well. However, we are able to, and we need to also make sure that we can overcome this third major outbreak, and the government will also exert our full efforts. As the number of cases increase on a daily basis, we have greater burden posed on the medical critical capacity. As for the severe or critical conditions patients, and as for the mild symptom patients, we are increasing the number of life treatment centers, and the operation utility rate of these centers are 68%. And today we have 2 more centers opening, and we have about 10 facilities that will open until next week, and we will be able to house more than 1,750 patients going forward. And as for these hospitals, we also have the designated hospitals. That is, we have about 62% utilization rate, and we still have some room as well. And we have a 95 critical beds hospital, critically ill patient hospitals. And however, we are expecting the increase of the numbers of patients with severe or critical conditions. And to this end, we are ensuring that we need to guarantee more numbers of these critically ill patients' beds. And going forward, we will be designating more hospital beds to the ICU treatment hospitals beds. And we also have a total of 176 hospitals that could operate as the critically ill for the critically ill patients, and about 30 hospital beds at the National Public Health Institute. We will also transform these to care for the critically ill patients as well. And going forward, we will also cooperate with the highest level of the hospitals and to ensure that we have increased beds for the ICU units, and these kind of measures will also be implemented going forward. And we will make sure that we do not have any inconveniences in treating the patients with severe or critical conditions. And as for the year-end holidays, we expect that there could be many gatherings and events, and we are preparing for such possibilities, including these Christmas and also the New Year's. Until the 3rd of January next year, we will designate this period as special quarantine period. And we ask you to refrain from going to any social gatherings and also cancel any of Christmas events as well as religious events and also New Year's Eve events. And please switch to non-face-to-face means. All of the parties and events that are hosted by accommodations, including party rooms and hotels, shall also be postponed as well. And also, as for the vouchers for dining out, we will also be switching this to be able to be utilized at delivery services. And as we have ended the Sunung exam, we will also make sure that we have the intensified measures until the finalization of the university entrance procedures, and until the 21st of December, we will make sure we will have intensified quarantine measures for all of these facilities that are partake by the test takers as well. And we will direct and guide the test takers as well as teenagers to refrain from going to multi-use facilities, including PC rooms, singing rooms, and so forth. And please note that all of the social gatherings for the year end shall be cancelled. And please refrain from going to other and travel to other provinces or cities if you are residing in the metropolitan area. And in order to ensure a safe year-end holiday, we will also provide many exhibitions and performances that could be enjoyed at home via remote means. And during the winter, we also see a high number of visitors during the winter holidays to the ski resorts and ice skating resorts as well. And these places will be designated as high-risk facilities, and we will intensify quarantine inspection. And as for other facilities that will also have more people, we are also to ensure enhanced quarantine measures. And as for family restaurants, we will make sure that we have intensified inspection measures. And as for amusement amusement parks, as well as indoor sports facilities, we will also have stronger quarantine measures. And as for high-risk facilities like the nursing hospitals and hospitals, we will make sure that we have the massive preemptive testings to make sure that we do not have further spread of the virus. And we will also note that the importance of during the year-end holiday is abiding by quarantine measures, and they are the four following. First, please refrain from going to gatherings or social events, and in particular, if these events entail a group dining, please cancel all of these gatherings. And second, please refrain from going to crowded and confined places that have close contact environment. In particular, saunas as well as sports facilities, as well as a dining where you cannot wear face masks, please avoid these activities. And third, if you have any symptoms, suspicious symptoms, please get tested as soon as possible. And recently, we are seeing a greater proportion of patients in their young generations and the middle-aged generations as well, and please take particular precautions. And last but not least, wear your face mask at all times and comply with personal safety measures, including washing of your hands. And the government will also make sure that the rest of the public can abide by these quarantine measures, and we will promote these campaigns on a public level as well. And as for the test takers and their guardians and parents, our 수능 exam ended yesterday without any inconveniences. We also like to thank you once again. We have the upcoming college entrance procedures, and we ask for your participation in the quarantine measures going forward. Please refrain from going to multi-use facilities and have intensified quarantine measures at private cram schools as well. And lately, as we've seen a large increase in the number of confirmed patients, we are also seeing increased stigma on the social stigma and the discrimination on the confirmed patients as well. And it is very important that we have a social solidarity and cooperation in order to overcome the COVID-19 outbreak. Meanwhile, there were also some people who did not have testings even though they have showed symptoms. And as for the national exams going forward, we will make sure to grant the opportunity to take the test that is at isolated facilities. And during the weekend, we ask you to refrain or minimize your social gatherings and religious gatherings. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다.
That was Health Ministry official Yoon Tae-oh we just heard from, filling us in on the latest COVID-19 cases in Korea, which confirmed 629 new cases of COVID-19, bringing the accumulated number of cases to 36,332 as of Friday midnight. Unfortunately, there were 7 deaths from COVID-19 as well, bringing the total to 536. Now this brings us to the end of our morning COVID-19 briefing. We will be back though with our regular midday newscast with Mark Broom. Bye for now.